All right, we are right at the top of the hour, so we will go ahead and get started. Thank you all for joining us this evening. We're so excited to have you here today, and we're so excited to have our special guest speaker. With us today, we have Lizbeth Blake, who is one of the clinical dietitians at the Park City Hospital, and she is going to be here today to teach us how to embrace integrative and functional nutrition to personalize care and treat lifestyle diseases. Liz grew up in rural West Texas, where she attended undergraduate school at Texas Tech University with a Bachelor's of Science in Dietetics and Nutrition, and she also received her Master's of Science in Clinical Nutrition at the University of Kansas Medical Center in Kansas City, Kansas. Currently, Liz is a clinical dietitian, like I mentioned, at the Park City Hospital in Park City, Utah, and has worked in the Live Well Center for the past 12 years. Liz is certified in adult weight management and integrative and functional nutrition. She has worked with diverse clientele, including weight management, sports nutrition, kidney disease, I can't even say that word, and enteral nutrition. Liz is a lifelong runner who enjoys the challenges of road and trail marathons and loves to mountain bike. So with that, please join me in welcoming Liz to talk to us today about all of the great things that she knows and can share with us.
Hello, can everybody hear me?
Yes.
Okay, great. Thank you for that nice introduction. And yes, I've been here in Park City for a while, and we are all super excited about embracing this new integrative way of approaching nutrition, along with many other things. But recently, me and another dietitian here, her name's Becky Cannon, we've decided to start using more integrative and functional nutrition within our practice. So I thought this would be a great introduction to show you what the differences are in integrative and functional nutrition, comparing it to sort of the traditional look. If any of you have ever had a nutrition consult, and how this will differ, and the things that we look at, and how we sort of attack the plan a little differently. So integrative and functional nutrition definitely helps us to identify the root causes and imbalances. And I think that's one thing that happens a lot in traditional medicine. If you want to look at it like this is sort of Eastern medicine meeting Western medicine, and utilizing both parts, because for sure you need both parts of it to make the best plan for the patient. So with integrative and functional nutrition, this is kind of a little definition. We'll call it IFN. It's therapy, it's leading edge, it's evidence-based systems biology approach to patient care that focuses on identifying root causes and imbalances to significantly improve the patient's health outcomes. So normally a registered dietitian would cover some basic things. Of course, she would sit down and consult with the patient, but you know, we typically look at macronutrients like fats, carbohydrates, proteins, and alcohol, or basic micronutrients, calcium, potassium, zinc. We might look at, you know, food intake and your energy expenditure. We might also talk about food labels. But with integrative nutrition, dietitians definitely will dive in a whole lot deeper. We may look at diet trends, specifically if a paleo diet would be beneficial or a ketogenic diet. We also want to talk more about antioxidants and phytonutrients. We will look at food, mood connection, food cravings and addictions, and we will also want some different labs. You know, you go to a doctor and you have maybe your blood work done, and you know what your sodium is or your albumin level, maybe your cholesterol, but we may want to look at some completely different labs, which I'll talk about in a little bit. So just keep in mind that IFN, it requires a much deeper understanding of the body's function. It looks at pathology, networks of physiology, and integrative nutrition. And you really need a trained clinician that will critically assess the patient, looking at the whole system approach. And we will build a personalized, holistic nutrition care plan to restore function and improve outcome. So it's a much bigger picture than just your general traditional nutrition. So working with clients through integrative and functional nutrition, this is what a consult would look like. So this is what we call the radial, and it has a lot of different pieces. You can kind of look at this as a puzzle, right? So we're going to review your food, lifestyle, environment. We will look at nutrition, your physical signs and symptoms. We really have to dig deep into those symptoms, biomarkers, metabolic pathways and networks. So we might look at stress, toxins, pathogens, like what are you around all day? Are you around different chemicals all day? Are you around different bacterias? Do you have allergies and intolerances? And so in order to look at all of this in this radial, you will get personalized nutrition care. So we would assess, it's called the ADIME, but we would assess, look at a diagnosis, try to figure out intervention, then definitely monitoring and evaluating. So conducting a consult, some of the key points, we will look at your medical history, any anthropometric measurements like your height, your weight, BMI, maybe your waist circumference, different measurements like that. We would also look at what supplements and medications you're taking. I know in traditional nutrition, we look at a lot of these things, but sometimes, again, it's really just a surface look. But with integrative, we would want to look more, like I've said before, just a lot deeper. Your dietary intake, food habits, your exercise routine, if it's cardio and strength, or if it's completely different, if you're over-exercising, under-exercising, what type of work you're involved in. Is there a lot of stress? What your emotions are, and if there's anything affecting your emotions. Do you have a support system? Is your support system, really helpful? Or is, who in your community is your support? Who in your family is your support? Allergies and intolerances. So developing a plan, everyone is different. So I think that's one of the cool things about integrative nutrition is we'll look at the emotional, nutritional, and physical because everyone is different. And clients can have similar issues in common for sure, but with the level of RD and client discussion, goal setting, and the path to achieving them will differ from individual to individual. So this, the picture didn't completely get on there, but this is basically what the matrix looks like. We call this the functional medicine matrix. And we work through this matrix with every single client. And so in the middle, we have to solve based on what a client, gives us in their history or their story. And I think the story behind an individual often gets overlooked by traditional methods. When a dietitian does a consult, we talk to the patient, but it doesn't always allow us the real deep story behind what is truly happening. Like, how long ago did this start? What are some of the antecedents? What are triggering events that maybe make your symptoms or problems are happening? Do you have any mediators or perpetuators, but we really look also at your sleep. How well are you sleeping? Are you having, problems relaxing? Exercise and movement, specifically, nutrition, stress, relationships. So all of these things play a part. And so I'll kind of show you an example of, one of these matrices completed. For example, this person has some antecedents that are high intensity training. Maybe they're a vegan. Triggering events might be if they're having, GI distress. Maybe all of a sudden they're having more more GI distress if the family is causing, problems at home, or if there's family illnesses. Maybe they have poor diet and they just stopped exercising. So there's a lot of different components to the matrix that helps us create a bigger picture. So if you were going to be coming in to see a dietitian, she would go through this matrix with every single individual. So some examples of antecedents are these ATMs for short. Your antecedents may be congenital problems, dietary, hereditary, demographic, habitual things, environmental, but triggers could be some sort of trauma, microbes, antigens, environmental toxins, social interactions, and then mediators obviously could be hormone problems, your current thoughts, beliefs, or cytokines. So there's different ways to look at each specific part to sort of uncover why someone may be having problems like GI distress or low serum B12, if you look at the middle, the white part of this matrix, because these are all the problems that this patient is having, but you've got to kind of figure out why. So some examples of treatment. There's a lot of ways to treat a patient, but we definitely want evidence-based treatment. And it has become a more precise way to diagnose, assess, and treat. And as you guys all know, let food be thy medicine and medicine be thy food. You've heard that from Hippocrates. And I think that we really dive into wanting food to be the true medicine. In the next couple of slides, I'm going to give you some examples of types of treatments for different diseases. But, you've all probably heard of a Fodmap diet or a specific carbohydrate diet, the SCD diet, maybe the SIBO diet for small intestinal bacteria overgrowth, or maybe even the wall protocol for MS. So, traditional dietitians will use these, but we'll really utilize these a lot more because we'll have a lot more evidence to support why we're using them. So let's take a look at migraines, for example. If they're food related. First, we're going to ask the client to keep a food diary and help identify triggers. I know maybe you guys have done, some of you maybe have used food diaries before, but they're so helpful when it comes to really diagnosing and figuring out where the problem lies. Journaling can obviously lead to patterns, and maybe the RD will start with a food elimination type of diet. But when you're writing your journals, you have to be super specific. When the food was eaten, when it caused the headache, or at what point of the day, like how long, when did you eat the food, and then how long did it take for you to have the headache? The severity of the headache. Did you have a small portion of that food, some foods, or did you have large portions? You have to compare everything. So migraine treatments, there can be a lot of, obviously there's medication treatments, but one thing's for sure, there are other ways to treat migraines. For example, sometimes migraines can be a problem of the sinus cavities. So keeping the sinus cavities clean and free of debris, maybe with the neti pot. Feverfew has anti-inflammatory properties and antibacterial properties. So we may encourage the use of the supplement Feverfew. And always remember to note all other supplements that you might be taking, because there could be contraindications. Depression, this is a big one. Highly used medications for the treatment of depression. But nutrition also plays a key role in helping with depression. And there may be many different ways that we can treat it. So nutrients can have a positive impact on neurotransmitters like norepinephrine, dopamine, and serotonin. So there are supplements like SAMe, omega-3 fatty acids, folic acid, and B vitamins. So we really have to look at not just treating something with a medication, but is there something else that's a supplement or part of a diet that we can use in maybe in addition to medication or completely separate. But supplements have shown to help with mood regulation. So, for example, omega-3 fatty acids. More and more studies have supported the idea that omega-3 fatty acids can relieve symptoms of depression. Current recommendations call for a minimum of 1 to 6 grams per day, depending on the client and the severity of depression. Flax seeds or flax oil supplements are also adequate substitutions if you're a vegetarian or a vegan. There is a positive correlation between an insufficient intake of omega-3s or an unbalanced ratio of omega-3s to omega-6s in the body and an increased rate of depression. Research to determine the correct doses of omega-3 fatty acids to alleviate symptoms is underway. There's also the use of SAMe. The supplementation can result in increased brain monoamine levels, which also enhance and support neurotransmitter receptors, which can also help influence and improve depression. There's another supplement, folic acid. There's a link between depression and low folic acid levels. Decreased levels of folic acid lead to decreased serotonin levels. And obviously, we all know serotonin helps with mood and overall feelings of happiness. So in some cases, as little as 200 micrograms or 1 cup of cooked spinach may be enough to help relieve minor depression, although 400 micrograms and up to 1 milligram daily appears to be more effective. But as you can see, maybe we can just treat this with asking you to increase your intake of folic acid foods like spinach, or we can supplement. But there's a lot of foods and supplements that really are helpful. And if you guys know about it, you can start with these. And then if you end up needing medication, at least you tried food first. And SAMe, it's just another supplement that's helpful. It's been around for a while, but dosage is very individual. It's absorbed pretty quickly in the stomach, and you can, if you take it with food, it may be a slower absorption, but it doesn't alter the effectiveness. Then we have the anti-inflammatory diet. This is a very common diet that integrative and functional nutrition dietitians would use. It has a lot of different parts and pieces that can help with a lot of different disease and problems. So the anti-inflammatory diet is a great way to tackle certain disease. Many foods that we eat create inflammation, and many can defend against inflammation. Inflammatory foods obviously lead to disease like IBS, arthritis, atherosclerosis, and eczema. The anti-inflammatory diet really does attempt to balance omega-6 and omega-3 fatty acids, which should normally be around a 1-to-1 ratio, but typically we're getting more like 15-to-1. So it's 15 too many omega-6s and too few omega-3s. Some anti-inflammatory foods. So foods that we would encourage, or I'm sorry, not encourage. These are the foods that we want to reduce. Sugary foods, dairy, and particularly like the high fat or more saturated dairy, red meats, and processed foods. Foods, a lot of packaged foods, high sodium foods. These are the foods that we really would work on for reduction. Our Ds would be encouraging these other foods, more fruits, especially berries, whole grains like quinoa, wheat berries, oats, vegetables of all kinds, the non-starchy veggies, and some starchy veggies, but in particular, the dark green vegetables. We also want more nuts, more seeds, and herbs and spices. So herbal supplements for the anti-inflammatory diet. We have turmeric, we have boswellia, licorice, aloe vera, reputable sources of vitamins and mineral supplements. But never forget the ones that are contraindicated for like prescription drugs and other supplements. So that's another piece of the puzzle. You know, a lot of people are taking a lot of supplements these days, and we really want to make sure that we are looking at what you're taking, and we have sources to make sure that you're not taking stuff that will interact with each other in a negative way. So some examples of other supplements for different conditions. So we have supplements that we, yeah.
I do just want to jump in and let you know we've got about 8 minutes left. So just wanted to let you know so you can leave time for questions if anybody has questions.
Yes, I will wrap it up. So we have lots of supplements that we can use, and just remember that, you know, like for example, for hyperlipidemia, there's over-the-counter supplements that we can, you know, utilize. There are supplements for supporting diabetes. There are lots of supplements that we can use for immune function, zinc, vitamin D. We all know lately with COVID, vitamin D, zinc, vitamin C, we're hearing a lot about that. So I think, you know, what's really important here is making sure that the dietitian that you're talking with has a great wealth of knowledge and understands your complete story, what your symptoms are, and this will really allow us to utilize real food and supplements to help solve your problems and really get to the bottom of it. So I guess I can kind of end on that. There are phytonutrients that we can, you know, obviously that we'll look at too, but really the big picture here is with integrative and functional nutrition, we're really going to look at the whole picture and just get the best understanding that we can of what's going on. So I'll just kind of end with that. Do you want to? Yeah. If we are ready for questions.
Awesome. Thank you so much. That was so, I know I was taking notes and learning a lot, and just thinking back about my husband who just met with a dietitian, and just thinking about some of the things that they shared with him and comparing to what you've just shared. So that's been really helpful. Thank you for sharing all this great information, but would love to open it up to the group. Are there any questions that you have for Liz before we close out this webinar for today? Feel free, and I should have mentioned this, feel free to type your questions in the chat at the bottom, because I believe you're all muted, so you won't be able to ask your questions out loud, but we'd love for you to just type in any questions that you have in the chat, and I can read those to Liz for you.
Yeah. I also just popped up this one other slide talking about phytonutrients, because I think this is one of the biggest things that the integrative and functional nutritionists will dive into, is making sure people are getting all their phytonutrients from all the different colors of foods. And, you know, there's different nutrients in every color. So you have to make sure you're getting really all the colors. And there's so much to all of this. So it's hard to give all of the information in 30 minutes.
So there was one question that came in, and I'm just trying to pull it up. Give me just a second. Sorry, it popped up in a different window, but I know it was related to, okay, so one of the questions is can you explain the Fodmap diet? Why would someone be eating that way?
Okay, so the Fodmap diet is, it's a diet we use for a lot of irritable bowel syndrome and some other problems that are creating maybe diarrhea or just gas, bloating. And we start with the Fodmap diet because it lowers, you have to follow a specific foods. It is sort of a restrictive kind of diet because it's like, don't eat these foods, but eat these foods. And they're low in these special sugars. And they're all like oligosaccharides. So, but these are in a lot of foods. So you have a lot of options of foods to eat. But if you eliminate these specific types of sugars, it really does help with relieving symptoms. I think people want to eliminate gluten right away, but a lot of problems are really follow into these specific sugars. So we use it all the time, and it's very effective if people use the diet right.
Awesome. Thank you.
Yeah.
Another question that came through was, how do we find a dietitian who looks into these? So how would someone find a dietitian like you if they were interested?
So, so obviously myself and Becky Cannon are here and we can help, but we're trying to get more dietitians that are certified within Intermountain. So I would have to just say, stay tuned, but there probably are other integrative and functional dietitians with Intermountain, but I actually don't know all their names. So maybe touch base with me and I can maybe find a better list of people to talk to.
So do you have a slide, Liz, that has your contact information or how someone would reach you at the Park City Live Well Center if they were interested? Or if you want to just pop it in the chat maybe before we end the call today?
I will try to pop it in the chat if I can find my chat on my screen. For some reason, my screen looks different, but you know what I can do? Well, I was just wondering if I could type in here, but I'll just give me a minute. I'll figure it out.
Okay, and while you're thinking through that, there was one last question.
Yeah.
What are your thoughts on ketogenic diets for weight loss?
Well, this has been a huge conversation lately, and really one diet does not fit all, and particularly the ketogenic diet. And if someone was really interested in the ketogenic diet, I think it can be useful, but not for everyone. I know everyone is like, oh yeah, it worked for me, but that doesn't mean it's gonna work for you. So I think, after sitting down with somebody, it's never gonna hurt to try it, but it really has to be done right. And a lot of people are not doing it right. Actually, more people are probably following the Atkins diet and not a ketogenic diet. Because when I talk to people, they're eating way too much protein and way not enough fat. So, which falls in line with the Atkins diet. So.
And I love that. It sounds like the approach that you take really is, like you mentioned at the beginning, really that personalized approach and not one size fits all. So I really like that.
Yes. And there are some people that it really has been shown to be beneficial for. That maybe if you have diabetes, and maybe it's you really need to get in control of your diabetes. That would be one person that I would most likely try it with. But you do have to investigate pretty deeply. So.
Well, I'm not seeing any other questions in the comments, and I know we are right at 5:30. So if there are no other questions, we can go ahead and end today. I'm going to go ahead and stop the recording, and I'm not sure if you were able to get that information to put in the chat here, or if you want to send it to me, I can put it in the chat once we end the call, because I think that should still send out to everybody.
So the chat will stay. If you want, I can just give you the phone number over right now out loud, if that works.
Yes, and then I'll just type it in the chat.
Yes.
So give me just 1 second.
Okay.
Park City Live Well Center. And what's the phone number?
It's 435-658-7119.
Perfect. So hopefully everybody on the call was able to hear that, but I've also put it in the chat if you're interested in learning more about scheduling an appointment with one of the dietitians there. All right, well, I am going to go ahead and stop this recording. Thank you so much, Liz, for being here today. I know that I learned a lot, and I know that others did as well. So thank you so much.